Hi, this is Eric Durek, and welcome to this edition of Med Health Fit. For our program tonight, I actually want to split it up into two different areas. The first one is new information about diabetes and self-care, and the second part of tonight's show is going to be all about hypertension and self-care. So let's get right to it, and let's start out with our first slide. This is Diabetes Self-Care Program, and basically what I want to talk about with you tonight is how to reduce your risks of getting diabetes through prevention and education. So let's look at our table of contents. What I want to deliver tonight is knowing what your diabetes numbers are, okay? Your fasting blood sugars, your A1C, all of that good stuff. We were going to talk a little bit about regular health checkups, your blood labs, the using insulin and oral agents. We're going to talk about self-monitoring of blood sugars with some very cool new technology. We're going to talk about a daily meal plan. We're going to talk about getting that regular exercise, the best diabetes prevention diet you might possibly be able to eat, and lastly, having a visit with your diabetes educator. Now, we've spoken about diabetes in a number of our shows. We've talked about diabetes and exercise, and that included aerobics and strength and range of motion. We've talked about diet, and we certainly have talked about diabetes self-care. But I want to talk about some things that are happening now on information that we just got together. So let's look at a very interesting slide here on A1C, or your glycosylated hemoglobin, and the incidence rate of certain types of diabetic complications like blue, retinopathy, the red line, nephropathy, the green line, neuropathy of the kidneys, and the yellow line is microalbumina. All right? So if you look at, as your A1C number goes up, your incidence, your relative risk of getting these long-term diabetes complications also goes up. And let's take one more look at the slide here. So your fasting, your blood sugars, all of these things are important, but if you look at is how the A1C goes up, you can see that these numbers, they also trail up as well, especially the neuropathy and the retinopathy. So the higher your A1C goes, the more you may have problems with your eyes and the more that you may have problems with your kidneys. So it's absolutely important that you keep your blood sugars stable, and we're going to talk about that with the next slides. So when you go to your doctor's office and he wants you to lose weight, he usually talks about your BMI, or your body mass index. And they usually measure your body weight on a scale, but then they'll calculate your BMI on a chart, which we can see right here. And normally a BMI in most adult healthy males is between 18 and 25, and in women it's about 18 or 19 to 26 or 27. And the BMI stands for body mass index, and the goal, if you're interested in losing weight to improve your blood sugars, is to lose about 2 pounds a week, which is safe weight loss. If you have a weight loss company that says you can lose 10 or 15 pounds in the first week, I guarantee you most of that is going to be losing water and losing muscle. And that's the last thing that you want to do. You want to maintain very good body water, and you want to maintain good, strong muscle tissue. So if you're losing weight correctly, over the first month, month and a half, your clothes should actually start fitting just a little bit looser. So the next big value we've talked about before, but I want to reiterate for tonight's audience, is A1C. A1C is the blood test for glycosylated hemoglobin. And from 0.5 or 1 to about 5.5 or 6 is considered a normal A1C test. And anything over 6.5 to 7 is you're in good diabetic control, but when your A1C numbers start to get to 7.5, 8, 9, 10, or 11, you have very high sugars, and they are reflected in the amount of sugar that's bound to your red blood cell. That's what your A1C is, and it usually lasts about 2 or 3 months. So as you exercise, as you lose weight, as you change your diet, your A1C gradually will get better over time, okay? So if we look at the thermostat here again, we can see that The non-diabetic levels are between 4 and 6. Your mid-levels here are between 7 and 8. And then between 8.5 and 10.5, the two upper ones, those are very high levels. Most doctors are going to say, we need to get your blood sugars down. We need to get your A1C down. Because if you have a level A1C that's over 10, you're looking at chronic blood sugars of about 250, 260, 270 milligrams per deciliter. So A1C numbers accelerate the risk of diabetes complications. So the main emphasis for any diabetes self-care program is knowing what your A1C is and knowing the best way that you can reduce that number every day. So one of the other things that your doctor looks at is your cholesterol panel, your cardiovascular risk panel. And that may have something to do with your HDLs, your LDLs, your total cholesterol, your triglycerides. So a good cholesterol number for most people is under 200 milligrams per deciliter. All right, and we can see on the chart here we have borderline that's around 200 and high levels that are over 240. If we look at our high density lipoprotein, a low level in male is 40 and 50 is for females. Men would like to get that HDL number better than 55 and in some cases better than 60 milligrams per deciliter. And your triglycerides is a number that if it gets up to about 150, 160, 170, it's becoming too high as well. So knowing that that number is under 150 milligrams is the optimum. That's what you're shooting for. And lastly, your HDL, total cholesterol ratio, should be about 3.5 to 1. And so these are the numbers that most doctors will have you look at. Cholesterol under 200, HDL greater than 55, triglycerides under 150, and your HDL total cholesterol ratio is about 3.5 to 1. All right, we're going to move on here. Fasting and post-eating blood sugars. Most people have no idea what their fasting blood sugar is until they go to a doctor and get a blood panel. And if they have a number that's 75 or 80 milligrams, that's a pretty good, stable number. Anything under 100 is actually considered reasonably good. But if you have a number, a fasting blood sugar that's about 110, 115, you may be in you may have some issues with your blood sugar control. Postprandial or after eating blood sugars in most people who don't have diabetes, even if it's a high carbohydrate meal, it's going to level off somewhere around 140 to 150. So if you have a number that's over 165 or even closer to 200, you know that you probably have diabetes. Because in most people, even with a not so good diet, they're going to be able to regulate the amount that their blood sugars go in any given meal. So the goal is to keep these blood sugars consistent during the day, not too high, but also not too low. So between 100 and 160 is almost the perfect level, perfect range that you can have for your blood sugars. Well, any other numbers that we need to know about? I'm going to actually steer you in the direction of a stress number right now. Because stress values is something that's perceived by a person, but it also has physiological ramifications. Increase in insulin levels, increase in cortisol levels, etc. So if we look at a number here that corresponds to a person's blood pressure that might be over 130, over 80, and in our next talk on hypertension, we're going to discuss a lot more about blood sugar levels. But if you have high blood pressure, if you have high stress in general, perceived stress, and you have higher insulin and cortisol levels, you may actually be in not a good place physiologically. And a recent survey here last year looked at what an average stress score was for both men and women. 0 being, 1 being hardly any stress at all, and 10 being a tremendous amount, almost stress levels that you cannot control. On average, men had a stress score of about 4.9, and women were right about the same at about 5.3. And people say, well, women, they can handle stress better or whatever. That's the point of this slide is that both men and women have stress scores that are over 4. They should be down at 3, possibly 2, but they're not. They're almost at uncontrollable levels. 5, 6, I think probably 5.5, 6.5 would be almost an uncontrollable level. It's affecting your work, it's affecting your sleep patterns, it's affecting your weight, it's affecting a lot of different types of things. So we want to look at stress levels, and then if you understand the basics of what we're talking about in terms of your blood labs, your stress, and your self-glucose, now you want to figure out what sort of tests that you're going to need. Your doctor's probably going to recommend a stress test. Your dietitian's probably going to recommend that you sit down with them for an hour and go through meal plan assessment, and you're going to have to learn how to do blood sugar testing. So we're going to talk about that in just a second, but these are pretty much the three main lifestyle components that people look at in terms of their long-term health. And again, keeping blood sugars down means that neuropathy, which is peripheral neuropathy, your nephropathy, which is the kidneys, your retinopathy, the small vessels in the eyes, and your microvascular disease of the heart, all are lessened. So again, I'm going to reiterate that as A1C and blood sugars go up, your complication status also worsens. So if you want to make sure that you have great eyesight 30 years after your diabetes diagnosis, you've got to keep your blood sugars in control. Well, most people have their own home blood pressure monitor if they have a blood pressure. They buy it on Amazon or something. And they also have their own testing unit. And most people use what's called a finger stick method, where they take a small drop of blood from their finger or their hand, put it on the unit 3, 4, 5, 6 times a day, and it gives them a blood sugar reading. Well, interestingly enough, the most important thing that might be applicable to keeping blood sugars low is fitness. And in order to understand what amount of fitness that you can do, you might have to do a fitness evaluation, cardiovascular strength, range of motion, and some sort of related diabetes stretch. People who've had diabetes for a long period of time, they usually have them do the preacher stretch. And if they can't put their hands together and go into this type of a stretch, they know that they've got some extra, what we call glycosylation within the hand tendons. So this is actually a pretty good way of testing to see if the person has got good range of motion. Okay? The blood sugars will really respond well to fitness, but we need to have a base point. The next thing here is a nutrition evaluation. So how many carbs do you have during the day? How many fats? The types of fats, omega-3 versus omega-6. What types of organic foods do you eat? Are you a vegetarian? What kinds of sports drinks do you have? So there's a lot of issues here in terms of what kind of foods do you take in each day that help maintain solid blood pressure or blood sugars. All right. So in terms of insulins, usually doctors will recommend to their patients a specific type of diabetes regime. And Michael, if we hold this on this for a second, I'm going to show that there's 4 different types of insulins that are being used today. The first one is a very rapid insulin. It gets into the system very quickly and then it drops. Most people use a short-acting insulin, which is regular. They'll have it in the morning, they'll mix it with another type, they'll have it at lunch to cover the foods that they eat, and then they'll take another small percentage of that in their evening insulin regime. They may take an intermediate, like an NPH insulin, but a lot of people will take a long-acting in the morning and it'll stay in their system during the day. So then they can regulate the amount of short-acting insulins they have based on either drinking a beer or having a dessert after a meal. So what types work best? These are the types of things that you have to work on with both your physician and your diabetes educator to really find out, based on your weight, how many years you've had diabetes, and what type of fitness routine that you have, how it's going to affect your insulin regime. The goal for many diabetics is that they can take 1 less insulin shot a day by virtue of being very fit. And over the course of, let's say a month, that's 30 less injections that they have to have. So it's very interesting that one of the things that can be manipulated the most based on lifestyle, you've changed your diet, you're exercising more, you're doing meditation, etc. You actually will have to change the amount of insulin and the types of insulins that you change during the course of your your self-care program. All right, well, I want to talk a little bit about self-monitoring because 30 years ago when I started doing medical research is when the self-monitoring machines came out. And even back then they said, well, someday maybe we'll have a non-invasive glucose tester. We won't have to jab our fingers. Well, today most people do. They just think it's, it's part of their routine. Where do you stick your finger, or where do you stick the needle so it doesn't hurt? Most people do the sides of their fingers, but over time they're saying, well, you can use your hand, you can actually, some people use the middle of their arm. It just hurts less, but you're still getting the same amount of blood. So you measure your blood sugars and they'll tell you whether or not the nutrition pattern that you have is a little bit too high or it's a little bit too low. So, most people test at least 3 times a day. Many people test up to 6 times a day. Blood sugar testing, no matter what kind of unit that you use, is probably one of the best ways that you can have in terms of self-care out of anything else. You can get blood labs 3 times a year. You can go see your doctor 3 or 4 times a year. But if you test your blood sugars every day, that's probably the best way to remain in very good diabetes control. So recently I did a talk for a big fitness conference down in San Diego. And in that talk, I was talking about, to the audience, mostly fitness professionals, about new types of technologies that are coming out on the market. And we talked about apps and we talked about fitness equipment and all this stuff. But one of the things that I told them, I said, for years people were using these blood sugar monitors. And finally, a company called Freestyle Libre has developed a monitoring machine where you actually put a patch on your tricep, just like the picture of the woman here. And she has a small, almost like a little cell phone that she can take, that she can swipe over that patch, just like a nicotine patch that you use for smoking, except this one's got a little disc on it. And you can wear it for up to 10 days, and you can monitor your blood sugar anytime you want over 24 hours. You can get hundreds of readings a day just by having that patch on the side of your arm. I think it's not only great for diabetes testing, it's also great for athletes who are doing long distance or heavy strength stuff. They can monitor their blood sugars. They can figure out how much food and protein powder and stuff that they may need during the course of the day based on this new type of technology. So I think that this is a spectacular and much needed step forward in terms of blood sugar monitoring for both diabetes and non-diabetes, but it certainly is going to be very, very applicable to folks with diabetes who want to test and they don't want to keep sticking their fingers. So this is the first and probably many of new technologies that are going to be around that are going to help people monitor. It's going to keep their self-control better, and I just think that in the long run, everyone's going to be healthier. So let's talk about developing a healthy daily plan. We're going to talk about work, exercise, eating, stress, and journal. And when I say journal, people say, well, who does a journal? I say, well, people who are interested in their foods, who are interested in the type of exercise that they do, should have some type of journal. All right? And in terms of stress, meditating every day, doing breathing exercises, all of these things are important because it's not just about the food, it's not just about the exercise. And having a good daily healthy plan should allow you on the days that you're not exercised, maybe to be doing yoga or breathing exercises or just 10 minutes of stretching so you can keep the muscles toned. And writing everything that you're doing in a journal is also very important because you'll remember the types of food that you had when you were on vacation. You can remember the numbers of blood sugar readings that you took during the course of the day. And if you were working out, what days did you do a leg workout versus what days did you do a strength workout for the upper body. So all of these things are in the journal and they're going to help you become more organized. And that organizational level is going to be beneficial in terms of, how are you going to keep yourself in good diabetes control. So my next slide here is called, there's an app for that. And to the best of my knowledge, there are between 6 and 12 million apps that are on the market now for, well, pretty much anything. But in terms of diabetes care, I want to talk about 3 of them that are on the market that I think are pretty interesting. The first one is called Educator. And no, that's not a Japanese word. That's an app. And Educator is with the little lemon, or the orange guy here with the headband on, is really an app that talks about weight loss and food monitoring for people with diabetes. So every time you get a food, you can tap it into your phone. It'll give you the calories, the sugar content, the protein content, the fat content, and it'll put it into your diet for the day. You have something for lunch, you put that in, and it gives you all of the content. And you put your weight in every day, and everything, all of these types of things that you put in there, and you put all of your blood sugar monitoring in there as well. And the Educator will give you what might be the best types of food programs that you can have to put you in the best diabetes control. Wonderful app. I believe it has a free download. The next one, which has got the big arrows here with the drop of blood in the middle, is called Glucosio. And Glucosio is a very interesting app. It basically allows you to store all of your blood sugar levels in one app, one area, and it'll tell you, well, this is, when did you have your high readings versus when did you have very low readings. And it will give you information as to sort of the best scenario about those blood sugar readings. Every time you test, it goes into the app and it gives you sort of a running log of how well that you do in terms of keeping those blood sugars in control. The last one is kind of interesting. It's called Beat-O. And it allows you to understand the highs and lows of blood sugar, and it also syncs with your Fitbit. So whenever you're running, you're walking, you get your total calories, you get your total steps, you get your total miles, all of those, and your heart rate, all of those things, the sensors that you use with the Fitbit, sync in with Beat-O, and it'll also help you monitor your blood sugar. So all of these types of apps, I think, do really well for what they do. So if you're only interested in looking at blood sugars, well, Glucosio is probably the one for you. But if you're a real fitness person and you want to see how those blood sugars really sync up to your Fitbit and your exercise regime, well, then maybe Beat-O is something that you can download on your phone today. Okay, so you've got all these new apps. Now what you need to do is look at what's the best type of exercise program. And I know that we've spoken about this in a number of different episodes, but I want to talk about how it works specifically with diabetes from a general standpoint. Number one is exercise almost every day. Your muscles will respond better and you will burn more blood sugar if you can exercise 5, 6, 7 days a week, as opposed to most people who may get 2 or 3 in. Then your muscles, they don't get used to it. The second thing is strength training first. All right, you want to go run 20 minutes on the treadmill? You can do that, but do your weight training first. Your upper body, your lower body, do all of those things. 3 or 4 stations, 5 stations, and then you can go walk on the treadmill, or you can do the stationary bicycle, or you can go out for a walk. So strength training comes first. The next one is aerobics. And aerobic conditioning, you say, well, I only want to go in and walk on the treadmill today. I would say that that's not a workout that most people should do only. Maybe go out for a walk if you're walking the dog, but aerobics comes in, you do that at the latter part of the workout, and the reason is that physiologically your muscles respond better to the aerobic exercise if you had a little bit of strength training. And so the other one is stretching. It should be a part of a workout, whether you're only stretching 2 or 3 joints, or you're doing a complete 20-minute stretch at the end of your program. You should use some monitoring device. I mean, today I don't see why someone wouldn't want to have a Fitbit or a pedometer or something that just tells them a little bit of information that they use while they're doing exercise, whether it's their heart rate, whether it's their total steps, total calories that they're burning, the total miles that they're walking, anything that you can have. You can have it on your phone, and your phone will be able to download most of that information. And then work out with a partner. Some of us like to work out by ourselves. That's fine, but a lot of people don't have that sort of get up and go. They need to have someone to call them up and say, hey, we're going to go work out today. So exercising with a partner is probably one of the more important things you can do to stay on your exercise regime. All right, well, we're coming to the end here. We've got a few slides to go, but what is the best diabetes prevention diet? Is it the paleo diet, which has got a variety of meats and nuts and fruits and legumes? It uses lots of oils, etc. And what they do is they avoid the processed foods, they avoid the dairy, starches and alcohol. And the benefits that they say for people is that they have much higher energy. It's an anti-inflammatory type diet. You sleep better, and of course you regulate your blood sugars as well. The other diet here is 40-30-30, which was one of the first types of lower carbohydrate diets for people who have diabetes. And they found that they can regulate their blood sugars very well on a 40-30-30 protein. It's low in processed foods, but they do use things like protein powder, and they have a little bit higher in organ meats than other types of diets. So let's look at a couple of these diets in terms of how beneficial they might be in terms of breakfast, lunch, and dinner. So for breakfast, what might you have for a paleo and a 40-30-30? Well, eggs, milk, protein shake, bacon, meats, some vegetables, maybe oatmeal or granola, which, high in nuts, walnuts and mixed nuts. Those would be part of a breakfast. Okay, you can have a little bit of vegetables, but for the most part, you see that these are high in fruits, or they're high in nuts, and they're high in organ meats. What's for lunch? Turkey sandwich, chicken sandwich, vegetables, maybe one piece of fruit, glass of milk. Maybe that milk has got protein in it. Tuna sandwich, mixed salad with olive oil, and maybe a small cup of blueberries. So you got a lot of antioxidants in there, but again, you have a higher protein content than just having maybe a piece of toast and coffee for lunch. Okay? So dinner is salad, cheese, protein powder, combination of these things, as opposed to avoiding things like lasagna, spaghetti, or pizza, which are much higher in carbohydrates. And then what kind of snacks do people usually have? Protein shake, protein bar, hard-boiled egg, a piece of fruit, cottage cheese with nuts, etc. All right? So they avoid coffee, they avoid diet sodas, they avoid certain types of foods, but they have organic foods, and they have minerals, okay? Lots of vitamins and minerals, all right? So let's visit your diabetes educator. They're going to assess your meal plan, they're going to look at your exercise and your sleeping pattern, they're going to look at your blood sugar testing, they're going to look at all of these types of things, and every time you visit your doctor, you should also visit with your diabetes educator. So where will you be in 6 months? You should lose weight, you should be exercising regularly, and you should be eating a little bit lower carbohydrate diet, and you should be monitoring your blood sugars always. And a year from now, you'll have normal body weight, you'll have normal blood sugars, your A1C will be normal, you'll be exercising all the time, life will be a lot better, and you will feel better most of the time. So this is our first segment for health self-care. This is Eric Durack for Med Health Fit. Stick around for our next segment.